As I mentioned, we are a group of 3 agencies that are partnered in providing high-quality, comprehensive care to individuals across the lifespan and across the diagnostic and functional need areas in behavioral health. We've been at this for many, many years. And with the emergence of the last 15 or 20 years of increased concern about access to mental health and chemical dependence services, laws that have recently passed to improve the parity of insurance coverage for those conditions, and a general consensus that issues like stigma and discrimination keep people from getting the services that they need, and that those services can make a huge difference in their lives. Mental health first aid is a really remarkable and important new intervention.
So John mentioned many of the advances that have taken place in mental health, but unfortunately, stigma is still an issue. And most recently, the National Council for Behavioral Health, cited the fact that there are over 8 million adults and children living with mental illness and addiction disorders in the U.S. So these people need to know that there's help out there, that they can and will get help. And, how do you do that? And how can each and every one of us help in that quest, or help them move towards seeking the help that they may possibly need?
Mental Health First Aid is a program, an 8-hour curriculum that really focuses on training folks from the community to provide initial help to whether it's young adults or adults who may be experiencing different levels of involvement with mental health issues, whether it's the beginning of a short-term mental health challenge, whether it's a developed mental health disorder, or an actual acute crisis situation. Mental Health First Aid prepares folks to be able to bring the initial stages of support and help to folks prior to professional help being available.
For this curriculum, it's a community-based, it's family, it's coaches, it's coworkers, it's everything, because we're talking about anyone who comes in contact with another person. And since we don't know each other's stories before we meet somebody, or we're shopping in a mall, this type of a skill goes with you wherever you are.
When we think about 1 in 5 youth, between the ages of 13 and 18, that's over 20% of young people in that age will have a mental health disorder. That significantly impacts their functioning. And when we're talking about functioning, we're talking about their school performance, their ability to relate and to be in meaningful relationships, to carry out just their daily activities. And when we think of young people in that developmental period of their life, this kind of impact can really shape the rest of their life. And so it's very important that folks in the community are very aware of signs and symptoms and what they mean when they're relating to young people.
All right, so the reason that we talk about mental health first aid is actually because mental health problems are common. There is stigma related with mental health problems. People will shy away, build up an issue. Mental health first aid helps with that. Many people are not well informed about mental health issues. And as Wayne was saying, the professional help isn't always on hand. And folks don't know how to respond. So this type of a class brings a comfort level and normalizes who we are as people and the people around us to a situation where we can all be a useful tool. But I always use the phrase, "it's more tools in your toolbox," because this gives you a skill set and a comfort level to be able to engage another person.
Concretely around mental health first aid, and really is something that I think shows the kind of the leadership and the forward thinking that our organizations, PSCH, Medicine Craig, and Mental Counseling Center have about how to carry out the missions that we hold.